And so what they found was basically that in looking at 3 different groups, one group being traditional resin technology, one being the Riva Bond LC, and the third being a Riva Bond LC and composite. They basically found that the Riva Bond LC for all of the different groups, being 2 and 3, that they yielded the best results with the minimal micro leakage, and the best one being obviously just using the Riva Bond by itself with composite had the best results compared to traditional bonding agent systems. And so again, a lot of great research talking about how well these are working. I think you're going to start seeing more and more of these coming to market based on how well they perform, and especially when you're utilizing them with these modern bulk fill based materials. And so let's look at an example here of utilizing the Riva Bond LC and placing a bulk fill composite on them. So once you've done your preparation design, you're going to go in here with your 37% phosphoric acid for 5 seconds. After implementing that, you're going to go ahead and rinse it off. You're going to dry it a little bit. You want it slightly moist. Now again, when we talk about what's slightly moist, at least with slightly moist on this, so long as it has a little bit of moisture there, you're fine. You can over dry it. You don't want to desiccate it, but at least if you have a little extra moisture, that's okay, because the material actually is made partially of water. So wonderful thing about glass ionomer systems is you can have a little moisture there versus traditional bonding agents. We know that can be a problem. So now that the preparation is ready, having etched it and dried it a little bit, we now go ahead and take the capsule of Riva Bond LC out of its packaging. And the nice thing is these are unidose. You can throw them away when you're done. You know you always have the right amount of ingredient in front of you. And so you're literally going to take this and tap it on the counter twice. And then after tapping it twice, you're going to actually depress it all the way down on the counter, and the little plunger at the base is going to go inside of the capsule, as you'll notice here. And so once it's now been activated and the little plug has gone into the capsule, you're going to go ahead and place it in your triturator. Now after it's mixed for 10 seconds, it comes back out. It has this little metal kind of perforated cap here on the top that you're going to go ahead and depress through with your micro brush. And after penetrating through there, you're going to go ahead and just move it around inside a couple times, kind of mixing things together a little bit, incorporating it onto the tip. When you pull it out, you now have your resin-modified glass ionomer bonding agent on the brush. You'll go ahead and paint that in the tooth structure. After painting it in there on the walls, you'll go ahead and try to avoid pooling. You won't want a big pool of the material the same as your bonding agent. You wouldn't want typically a pooling of bonding agent. You can thin it down a little bit if you happen to get too much, or just take another micro brush and start to pull out the excess with a micro brush if you get too much on there. And then you'll do a 10-second cure. So it's just like a traditional bonding agent as far as just rubbing it on the tooth and then curing it. And from there, whatever composite-based system you want to implement, or a glass ionomer-based system, you can use any of those on top of these, or even, like I said before, you can even put an amalgam on top of these. And so in placing your composite on top of this material, again, you're not going to have the same type of polymerization stress and C factors you find with traditional resin technologies.